Welcome, everybody, and good afternoon. My name's Carol Dawson-Rose. I am the Dean for the School of Nursing. And as someone asked me just a few minutes earlier, are you new? Yes, I'm new. So thank you for welcoming me, everyone, into this new role. I'm really excited to be here today because this is one of the fun points in our academic life where we get to gather together to celebrate everybody in our community, the learners, our faculty, staff, and the people that are important to them in their lives, family, friends, and colleagues. So I also think it's an opportunity for us to just take in all of the people that are involved and contributing to the accomplishments of the school. Over the next hour, we're going to be celebrating all of the people here, students, faculty, and staff members, as well as members of our professional community. We do good work. We do a lot of we make a lot of amazing contributions, and I'm excited to be here. And I want to recognize people, whether or not you win an award today. I just want to recognize your participation in the community. And I swear when I come back at the end, my camera will be in a different position. So I'm going to hand it over to Dr. Meg Walhagen, who is the chair for our Nurse Faculty Council and the director of the UCSF Hartford Center for Gerontological Nursing Excellence. Meg?
Hi, good evening, and thank you, Dean Dawson-Rose, and good afternoon to everyone who's in attendance. I'm so extremely pleased as the Faculty Council Chair to welcome you, family, friends, awardees, and faculty to this very important celebratory event. It also marks the coming end of an academic year, and thus we know that many of our awardees will be moving off to new transitions, new careers, and new opportunities. But this event is really a time where we have the wonderful opportunity to learn about and acknowledge the significant accomplishments of our students, our faculty, our alumni, our preceptors, and our staff. I think the awards demonstrate that the achievements you will hear about today do not go unnoticed, but are recognized and highly valued by your colleagues. Additionally, the awardees we honor this afternoon exemplify the diverse and far-ranging roles and activities that together support our School of Nursing and make it the excellent and highly regarded academic setting that it is. We could not achieve the school's mission without everyone working as a team. And this afternoon, you will hear examples of how very committed our team members are to teaching, clinical, research, and service excellence. Thank you and congratulations to all the awardees, and thank you to those who have joined us today. Now, before turning the microphone over to the first award presentations, I do want to acknowledge those who put this together and so carefully timed things out and made our nice background that's also celebratory. So I would now like to introduce Chi Vang, who's an assistant clinical professor in the Department of Physiological Nursing, and he has the opportunity to present the faculty-nominated student awards. Chi Vang?
Thank you so much, Meg. So to begin our celebration, let us honor and recognize the 2024 Student Award recipients. They are being recognized for work of particular merit and for contributions above and beyond the call of duty. The Distinguished Dissertation Award in Nursing recognizes the doctoral student whose dissertation best exemplifies scholarship and innovation and best contributes to the discipline of nursing. This year, there are 3 winners. Our first winner is Min Jung Kyung. Her dissertation is titled Work-Related Musculoskeletal Disorders, Reporting Attitudes, and Reporting Behavior Among Nursing Assistants in Long-Term Care Facilities in South Korea. Dr. Kyung's dissertation on work-related musculoskeletal disorders among direct care workers in long-term care facilities in South Korea reflects her extensive health policy background and dedication to improving worker safety and wellness. Her research, which includes a systematic review and original survey study, provides valuable insight into safety, climate, and reporting attitudes among nursing assistants, a population often overlooked in occupational health research. Despite the challenges of conducting research during the COVID-19 pandemic, Min Jung successfully established collaborative partnership with 19 long-term care facilities and recruited a substantial sample size. Her dissertation exemplifies the vital role of nursing knowledge in informing policy and practice to enhance the health and safety of marginalized working populations. Min Jung is a promising nurse scholar poised to make significant contributions to the nursing science.
Thank you.
You're very welcome. Congratulations.
Thank you. Good morning, everyone. I'm really honored to receive this distinguished dissertation award and truly grateful for this recognitions. Well, first, I want to thank UCSF for this amazing honor, and a huge thanks to my advisor, Dr. Hong and Dr. Lee, for their guidance and support, and also appreciate my committee members, Dr. Wagner and Dr. Hayes Adams, for their valuable feedback and encouragements. I hope my finding will help improve the musculoskeletal health of direct care worker, inspire more research and discussions. Well, I'm deeply appreciative and will carry this moment with me as a reminder of what dedication and passion can achieve. Thank you.
Thank you and congratulations. It is an award well deserved.
Thank you. Thank you so much.
Our next winner is Joo-Sun Kim. Her dissertation is titled Clinical Characterization and Molecular Mechanism of Dyspnea in Oncology Outpatients Undergoing Chemotherapy. Dr. Shin's dissertation on dyspnea in cancer patients is groundbreaking, providing comprehensive insight into the understudied symptom. Despite facing language and culture barrier as an international student, Joo-Sun's dedication and hard work have resulted in significant contributions to nursing. Her research has not only identified gaps in understanding dyspnea, but also provided evidence for future intervention studies. Her work represents a pivotal achievement in symptom science research, shaping the direction of future studies and interventions in dyspnea management. Congratulations, Joo-Sun.
Thank you so much. I really appreciate my mentors, Dr. Chris Miaskowski and Dr. Kurt Kober. You both provide me tremendous well-designed curriculums and numerous individual sessions and meetings and tons of encouragement during my doctoral dissertation project. Thank you so much for your love and support and tremendous encouragement. Due to all of your support, I was able to develop my skills as a nurse scientist. And as I said during my dissertation, defense, you both are my two favorite persons in the United States. Thank you so much.
Congratulations. Finally, our next winner is Kate Opengard. Her dissertation is titled An Evaluation of Co-occurring Cancer-Related Cognitive Impairment and Anxiety in Patients Receiving Chemotherapy Using Latent Variable Modeling and Pathway Impact Analysis. Kate's dissertation research focused on an evaluation of phenotypic and molecular characteristics associated with co-occurring cognitive impairment and anxiety in patients with cancer. This work identified novel targets for symptom interventions and provided several directions for future research. The impact of Kate's dissertation on the nursing discipline is profound. Her comprehensive conceptual model and scoping review provided a roadmap for future cancer-related cognitive impairment research, while her analysis of phenotypic and molecular characteristics established a new paradigm for evaluating risk factors and underlying mechanisms. Kate's work represents a paradigm shift in symptom science and has the potential to identify new therapeutic targets for interventions. Congratulations, Kate.
Thank you. Thanks to Chris and Cord. Much love.
Okay, so the next award is the Outstanding Doctor of Nursing Practice Award. This award recognizes a DNP student who best demonstrates scholarliness, innovation, leadership, and contribution to the discipline of nursing. This year's winner is Jessica Gaylord. Since being admitted to the Postmaster's DNP program, Jessica has brought extensive primary care experience from her roles in California, Arizona, and Switzerland. Jessica's scholarly project, titled Failure to Rescue, Nursing Training at a Community Hospital for Older Adults, emerged from a critical incident at her hospital. Her evidence-based quality improvement project developed a comprehensive nurse training program focused on SBAR communication, vital sign interpretation, and simulation-based case studies. Despite project challenges, Jessica's innovative approach involved translating materials into both English and German, making her project widely applicable. Jessica's leadership is evident in her collaboration with hospital stakeholders, and she has been instrumental in promoting interprofessional communication and safety initiatives. Her work has earned her national recognition in Switzerland, where she contributes to policy discussion and promotes advanced practice nursing. Jessica's dedication to nursing education, leadership, and innovation makes her a deserving recipient of this award. Congratulations, Jessica.
Thanks very much. I want to thank Terry Lindgren and all of the faculty in the DNP program in the School of Nursing. I got my start in nursing 20 years ago in the NEPIN program, and it's nice 20 years later to be at this point in my career. So thanks, everyone.
It is very well deserved. Congratulations, Jessica. The Outstanding Master of Science Student Award honors a student in Masters of Science in Nursing program who has demonstrated leadership, scholarship, and specialty expertise of the highest order. This year's award goes to Mark Tungle. During his preceptorship, Mark exceeded expectations by completing 2 impactful projects. First, creating a new RN pain quiz, and second, conducting a QI project on PCA documentation. His efforts benefited the UCSF nursing community and were shared at the Clinical Inquiry Conference. Mark's thesis on EKG monitoring and alarm fatigue, completed under Dr. Michelle Pelter's guidance, showcases diligence and scholarly acumen. He has applied evidence-based practice in his clinical work, spearheading reviews and quality improvement initiatives. As president of the Associate Students of the School of Nursing, Mark has shown outstanding leadership, hosting podcasts and organizing campus events. His dedication and strong work ethic make him an exemplary student and future clinical nurse specialist. Please join me in honoring Mark for this prestigious award.
Thank you all. Much love.
Congratulations, Mark. Next is the Outstanding Postmaster Student Award. This award honors a postmaster student who best demonstrates leadership, scholarship, expertise in the area of specialization, and potential for significant contribution to nursing and scholarship. This year's winner is Neil Oppenheimer. Neil has excelled in clinical excellence while balancing the challenging AC-P&P curriculum with his full-time role as a nurse in the UC Davis Pediatric ICU and Cardiac ICU. He serves as a preceptor, charge nurse, and educator, demonstrating his commitment to pediatric critical care. Neil's clinical rotation in various pediatric specialties have earned him high praise from his preceptors, highlighting his effective and knowledgeable approach. In addition to his clinical work, Neil has demonstrated remarkable scholarship. He has obtained a postmaster certification in nursing education and serves as a clinical instructor and mentor. His involvement in the mock code committee and the skin audit team exemplifies his commitment to evidence-based practice and quality improvement. His ability to reference evidence-based practice from memory during case discussion showcases his deep understanding of pediatric acute care management. Neil's leadership skills are equally impressive. He participated in the Rising Nurse Leaders program at UC Davis and implemented a project to support gender-affirming care in the PICU. Recognized for his leadership for 6 consecutive years at UC Davis and named Pediatric Nurse of the Year in 2020, Neil continues to inspire his peers and promote professionalism in the AC-P&P community. Congratulations, Neil.
Thank you so much.
The next award is Nursing Alumni Student Award for Emeritus Service. The University of California, San Francisco's Nursing Alumni Association honors graduating students who enroll in the School of Nursing and makes a significant contribution in service to the community. This year's winner is Sarah Nathan. Dr. Nathan is dedicated to serving low-income and immigrant populations in her practice. This extends specifically to sexual and reproductive health, emphasizing the connection between individualized care and factors influencing pregnancy desires and contraceptive behavior among youth. During her PhD program, Dr. Nathan secured significant funding through successful grant applications. As a principal investigator of the California Reproductive Health Service Corps project, supported by a $2.2 million grant, she enhanced access to abortion care and diversified the reproductive health workforce. She also leads the HRSA SAFER grant, valued at over $1 million, developing a curriculum for training forensic nurse examiners to address gaps in survivor care. Dr. Nathan has shown exemplary leadership, service, and commitment to advancing healthcare education. In addition to significantly impacting community health outcomes, her achievement and dedication make her a deserving recipient of the Nurse Alumni Meritus Service Award. Congratulations.
Thank you so much. And I really want to thank my dissertation committee, Dr. Susan Chapman, Dr. Corrine Roca, and Dr. Claire Brindis. And I really appreciate all the support from UCSF and the faculty community, as well as the student community.
Congratulations, Sarah. The final award is the Community Impact Doctoral Award. This award recognizes a DNP or PhD graduating student who has advanced health equity through their DNP project or a PhD dissertation work. This year's winner is Johanna Velasquez. Johanna's DNP project, Developing Professional Identity in Rural Hispanic Nurses Through Virtual Platforms, highlights her dedication to community impact. She founded a chapter of the National Association of Hispanic Nurses, known as NAHN, in California's Central Valley, an area with a significant Hispanic population, but previously lacking a local NAHN chapter. Through this initiative, Johanna organized workshops on job interviewing, resume writing, professional presentation, and hosted a webinar with the NAHN president that focused on professional identity in Hispanic nurses. The establishment of this chapter provides vital resources for the Hispanic nursing community, addressing the disparity where Hispanic nurses represent only 9.6% of California's workforce, despite comprising 40% of the population. Johanna's innovative leadership and commitment to professional development make her an exemplary candidate for this award. Her work has already made a substantial impact and promises continued benefits for current and future Hispanic nurses in the Central Valley. Congratulations, Johanna.
Thank you. Thank you so much. I would like to thank Dr. Carly, Dr. Elena Capella, Dr. Holgren, Dr. Alexandra Duke, who have continued to inspire me, be my great mentors, and always been available for me to continue on with this great project that I've continued to aspire it grows. Thank you to UCSF faculty and to all the DNP students who also have been supporting me as well through this journey. And not last or least, my family, who keep on providing me their support, their love, and encouragement throughout this journey. Thank you so much, UCSF.
Congratulations.
Hi, everyone. My name is Christina Kenny, and I just completed my PhD dissertation defense in the School of Nursing. And I'm very pleased to be here today to announce the 2024 PhD Mentor of the Year Award. This award is bestowed by graduates of the doctoral program in recognition of a faculty member's dedication, support, and guidance. This year's award goes to Dr. Linda Park. Dr. Park is recognized for her outstanding mentorship, her selfless dedication, and deep loyalty to the students, School of Nursing, and the profession of nursing is extremely inspiring to all. On a personal note, I'm privileged to have Dr. Park as my primary advisor and dissertation committee chair. She's truly a visionary, steadfast coach and mentor, and a trusted academic nurse leader. Her guidance, encouragement, and role modeling has been such a tremendous gift to me and so many others. Thank you and congratulations to Dr. Park.
Thank you, Christina. Those words are very kind, and I know that I share my sentiment that it is our greatest joy really to see our students and mentees succeed. So you are just a great example of that. This award means the world to me, so thank you so much.
Good afternoon. My name is Lindsay Davenport, and I'm a candidate for the DNP program. I'm very pleased to announce the 2024 DNP Mentor of the Year Award. This award is bestowed upon by graduates of the DNP program in recognition of a faculty member's dedication, support, and guidance. This year's award goes to Marianne Holtgren. Dr. Holtgren is recognized for her outstanding mentorship, her unwavering encouragement and stewardship to the students, the school, and the profession of nursing. It's an inspiration to us all. She's an active listener that deeply cares for her students. She pushes you to be your best, and it is because of her wisdom and selfless dedication that we, her students, are able to achieve our best. Her impact is measurable, and we applaud her achievement as the 2024 DNP Mentor of the Year.
Thank you so much, Lindsay, and all the DNP students. This is an incredible honor for me. And mentorship is a two-way street. I think I learn as much from you all as you may learn from me. I'm truly honored. Thank you so much.
Hi, my name is Kim Lopez, a nurse midwifery student in the master's program. I'm very pleased to announce the 2024 Teacher of the Year Award. This award is bestowed by graduates of the master's program in recognition of a faculty member's dedication, support, and instruction. This year's award goes to Cynthia Ballou. Cynthia is recognized for her excellence in teaching. Her unwavering commitment and willingness to provide guidance and support to students has not gone unnoticed. She goes above and beyond to ensure that each student reaches their full potential. Her dedication, passion, and excellence in teaching inspire us all. She is beloved by students and faculty alike. This award comes at no surprise at all. Congratulations, Cynthia.
Hi, my name is Sofia Villagomez. I'm a master's student in the Family Nurse Practitioner specialty, and I'm very pleased to announce the Emma DeBuckner Scholarship Award. This Trans Health Scholarship Fund was created in memory of Emma DeBuckner by her family and friends. The scholarship provides financial assistance for UCSF and UC Berkeley students who share Emma's commitment to improving the health and well-being of trans and gender non-conforming people. Each year, the scholarship will support one student on each campus who is working on transgender health and wellness or other transgender-related areas in research or community work. The scholarship will help to ensure that Emma's legacy in health equity and trans health will continue at UCSF School of Nursing and UC Berkeley for years to come. It's my absolute pleasure to announce that this year's award recipient is Carrie-Ann Perumal. Carrie-Ann is a committed, passionate, and hardworking advanced nursing student whose overall goal is providing quality, patient-centered services for underserved communities. Her academic career, mentorship, and motivations to work with diverse communities highlights her commitment towards promoting equity within healthcare and uplifting future providers and research, and she is an absolutely wonderful human being overall. Please join me in congratulating her.
Good afternoon. My name is Michael Ye, and I'm here with Dr. Marianne Holtgren, Associate Clinical Professor in the DNP program. You just saw her a minute ago because she won the Mentor of the Year Award. Wow. So we're here together to present the 2024 Kate Walsh Awards. The award honors my late wife who passed away in 2019, and I'd like to tell you a little bit about her. A San Francisco native, Kate completed a master's degree in nursing at UCSF, yes, in 2002. She went on to have a decorated career down south here at UCLA, where she became the assistant director of nursing. She was a mentor, an innovator, and a national authority on the topic of fall prevention in the elderly. She was proud to be a nurse. Kate and I were married for 16 years, and we raised two beautiful boys. The Kate Walsh Award was established in 2020. In a moment, Dr. Holtgren will announce the 2024 awardees. I want to thank her, Dean Dawson Rose, and the UCSF School of Nursing for helping us to honor Kate in this way. To the awardees, congratulations. I know that Kate would be proud of you.
Thank you so much, Dr. Ye. I'm happy to announce the two winners of the 2024 Kate Walsh Award are Maria Amada Fletcher Apusible and Maureen Haston. For this award, project ideas submitted by students in N263.14, the Quality Improvement Patient Safety course, examine the integration of quality improvement patient safety with the application of evidence-based practice and nursing leadership. Students are challenged to develop a white paper that articulates their ideas that address the core components of quality improvement and patient safety. These two students were selected by the review team as being exemplary of DNP scholarly work that has the potential to impact high-risk patient safety and risk avoidance efforts. Amada's project is concise training for ECMO practice providers utilizing an evidence-based guideline developed safety check for patients going onto ECMO. This project identifies a safety gap in provider coverage for patients on ECMO life support in the adult intensive care units and detailed an evidence-based training to improve quality and safety, as well as advanced practice provider confidence for managing patients on ECMO using a guideline-developed safety checklist. Maureen's project idea is to recognize the profound impact that delirium has on hospital patients' well-being, cognitive function, and functional status. She's investigating the use of delirium assessment tools to proactively identify individuals at risk who can potentially prevent or minimize the negative consequences of delirium. Congratulations to you both.
Thank you so much.
Yes, thank you. Thank you to the faculty and my family. Appreciate all of you guys.
Well, my name is Mika Estrada. I'm the Associate Dean for Diversity, Inclusion, and Outreach, and I am a little bit of a prelude in the middle of all of this. I've noticed that everybody's been thanking lots of people, and I want us to pause a little bit and thank ourselves. I want to take a moment to really absorb the wonderful work that you all are doing and that you have done. We're a diverse community, sometimes with strong opinions and ideas that contribute, and that contributes to our strength. So I'm going to ask you all right now to take a deep breath. Whew. And give yourself some grace and acknowledge that we've done the best that we can. I know that there's a lot of people, a lot of us are perfectionists, and we can often focus on what we haven't achieved or how we have fallen short a little bit. But in this moment and in this time together today, let's celebrate what we have done. I celebrate that every one of you has done, and that each of you in different ways are trying to make this world a little bit better, and that you all are working towards reducing suffering in the world in one way or another. I wanted to end by sharing a poem that acknowledges the struggle to do good, because all of you know what that is probably like, and the beauty of continuing to strive to work in that direction. This is an excerpt from a poem by Amanda Gorman. It's called New Day's Lyric. It says, "What was cursed, we will cure. What was plagued, we will prove pure. Where we tend to argue, we will try to agree. Those fortunes we forswore, now the future we foresee. Where we weren't aware, we're now awake. Those moments we missed are now those moments we make. The moments we meet and our hearts, once altogether beaten, now altogether beat. Come look up with kindness yet, for even solace can be sourced from sorrow. We remember not just for the sake of yesterday, but to take on tomorrow." And that's what you're all doing. You're taking on tomorrow and trying to make it a little bit better, even when our past has struggles and we are addressing all the difficulties of the world. And so I applaud you, and I'm grateful for you. And I hope that you really take in this moment and absorb the beautiful people that you are. Thank you.
Well, thank you, Dr. Estrada. I really am pleased to sort of follow up on that because I have the wonderful opportunity now to honor and introduce the faculty awardees. These are individuals who have been nominated by their colleagues. And the first award is for a faculty member who's nominated for excellence in clinical mentoring. And I think throughout this presentation so far, you've really seen the value that we place on the clinical activities that individuals are doing. The award this year goes to Kristen Sligar. Kristen is a family nurse practitioner and faculty member in the Family Healthcare Nursing Department. Nominators noted how Kristen skillfully tailors her approach to each student based on an expert assessment of their needs. As one student noticed, she has really helped me to step out of my comfort zone and has encouraged me to learn new skills that I know will help me when I'm a practitioner. Others highlighted the fact that her feedback was very specific and helpful. And she was kind and approachable, patient-centered, and that she shares her clinical expertise with students and other interprofessional team members during pre and post clinical conferences. She's invested in every student's success. Kristen was also noted to model cultural humility, structural competence, and patient family-centered care, as well as the highest level of professionalism as an interdisciplinary team member. She's held in high regard by colleagues at UCSF and Zuckerberg, where she practices. Congratulations, Kristen, for your contributions to clinical excellence and the development of the next generation of excellent practitioners.
Thank you so much. This honor means really so much to me. I'd like to thank the people who nominated me for this award and the committee for selecting me. I think mentoring is so important to the practice of nursing, and it would be remiss of me to accept this award without recognizing the individuals who have mentored me from the beginning and currently now, who inspire compassion, intellect, and embrace the joy of learning alongside me. So thank you so much.
Thank you, Kristen. The next faculty award is for excellence in creating a supportive learning environment. And this award goes to Louis Bannon, who is an adult nurse practitioner teaching in the adult gerontology nurse practitioner program. My heartfelt thank you for teaching in that program. Lou was described as the embodiment of kindness, generosity, and professionalism, whom one student has described as our emotional support faculty because of his demonstrated ability to hold space for concerns and worries, validate our experiences, and provide perspectives that leave us feeling braver and more able to engage with this rewarding and challenging career path. Another pointed out the support and encouragement that was received when writing the comprehensive exam, and they noted Lou's unwavering support and belief in me made all the difference during this challenging time. He empowered me to believe in my own abilities and to push me past my fears and doubts. Thanks to his guidance, I was not only successful in passing my comprehensive exam, but grew as a student. I will always be grateful to Lou for his impact on my academic journey. Lou was also noted to take time to get to know each of the students as distinct individuals with unique interests, strengths, and needs, and to encourage each student to take ownership of their learning by playing to those strengths. As one student noticed, Lou asked us questions about how we like to learn and how he could support us. He then used our responses to create conferences that were lighthearted, free of judgment, and perfect space for students to ask questions and grow. There's more examples, but leave it to say, Lou definitely created a highly supportive learning environment that one that encouraged the development of the students' strengths. Congratulations, Lou.
Wow. Thank you to all my wonderful colleagues for what is truly a great honor. This has certainly been a rough year on many levels, and I just want to thank all of our wonderful students for really exemplifying and embodying the characteristics of compassion, honor, and integrity. They've certainly been a model for me, I know. And I think it's really funny that I would get this award because, truly they have provided me with so much more support than I have provided for them. So I'm very humbled by this. So thank you.
Thank you, Will. The next award is for excellence in education or curricular innovation. This award goes to Elizabeth Castillo, a family nurse practitioner in the family health care system. Of special focus was the fact that she brought a much needed lens of equitable access to care for underserved communities and a focus on addressing health disparities, especially in underserved populations and in rural communities in California. She was noted to use creative and innovative approaches to course development to develop students who would be able to help address these issues. One focused on closing the opioid treatment gap via nurse activation, and that empowered early career APNs to treat opioid use through the inclusion of immersive clinical experiences and meaningful small group outbreak sessions with experienced healthcare providers specializing in opioid use disorders. That treatment disproportionately, there was focus on 3 specific underserved populations, which are disproportionately affected by this epidemic. And that included BIPOC communities, rural health communities, and transition age youth. She also developed an innovative curriculum with intensive clinical rotations across rural California that would prepare advanced nurse practitioners to alleviate existing health disparities for rural populations. And we know that's a very significant problem. Through these community engagement projects, students learn to utilize existing community resources to strengthen and improve health outcomes. She further exemplified innovation when she had to overcome the limitations of a highly rated course from in-person to one that was removed and having to be more virtual. So congratulations, Elizabeth, and thank you very much for your efforts to decrease health disparities.
Thank you. Let's see. I am truly touched by this recognition and incredibly humbling. This is an incredibly humbling award. Never really thought possible, but I've always kind of considered myself incredibly lucky to have just been accepted into the family nurse practitioner program many years ago. But never did I imagine I would ever have the honor to learn and work alongside the distinguished faculty at UC San Francisco School of Nursing. And I am certain that I would not be able to do the work that I do today without the support and motivation from my family, the department chairs, the directors, peers, my co-PIs, and of course the students. I'd also like to give a special thanks to Professor Dr. Liz Gatewood and Professor Matt Tierney for their leadership and faith in my abilities. Thank you again for this honor.
Good afternoon. I am Elena Portacolone, Associate Professor at the Institute for Health and Aging and the current chairperson of the SON Research Committee. On behalf of the School of Nursing Research Committee, it gives me great pleasure to introduce the recipient of this year's Ellen Nam Research Lecture Award. The award honors Dr. Nam, Dean of the UCSF School of Nursing in 1958. Dr. Nam pioneered efforts toward accrediting nursing programs, proposed that research and teaching were inseparable, and asserted that teaching was a form of inquiry. She also created the first nursing doctoral program on the West Coast and taught our students how to conduct rigorous qualitative research. In tribute to this extraordinary nursing leader, we honor this year's Ellen Nam Award recipient, Dr. Linda Frank. Dr. Frank is a professor and endowed chair in pediatric nursing and an internationally recognized nurse whose research has significantly influenced healthcare standards, policy, and quality of care globally to improve health equity and outcomes for infants, children, in people of reproductive age. She directs the Actions Pre- and Postdoctoral Fellowship Program in Reproductive Health and Justice, and she is also the founding director of the Ronald McDonald House Charity Center at UCSF, with the aim of contributing new evidence to accelerate and improve pediatric family-centered care and family-centered services in all settings where children receive healthcare globally. So please join me in congratulating Dr. Linda Frank.
Hi, everyone. Greetings from Europe. I want to thank Dean Dawson-Rose, Associate Dean Alcon, Dr. Portacolone, and members of the Research Committee and all my nominators for the incredible honor of being the Helen Nom awardee for 2024. I also want to thank Paige Gilbert for all her work to organize a marvelous celebratory event on May 8th. This award belongs not just to me, but to all of my collaborators, my research teams, and administrative and financial support staff. It belongs to my colleagues working at the front lines of healthcare, and to the parents and communities who participate in and partner in our research. Thanks to you all. And finally, congratulations to all the other School of Nursing 2024 award recipients. Cheers to your many achievements. I look forward to seeing you all soon. Bye.
Hello, my name is Denise Porter. I'm a family nurse practitioner, and I'm currently the president of the Nursing Alumni Association. And this year, I'm happy to recognize the Jane Norbeck Distinguished Service Award. Since 1984, the Jane Norbeck Distinguished Service Award has honored graduates of the UCSF School of Nursing who have made significant contributions to their profession. These remarkable alumni have demonstrated service and leadership that has contributed to the growth and development of the UCSF School of Nursing and the profession. This year's Jane Norbeck Distinguished Award Service Award goes to Pauline Chin.
Hi, I'm babysitting and I have 2 dogs at home, so hopefully no one's going to interrupt me in the minute I'm going to talk. I'm really honored to receive this Jane Norbeck Distinguished Service Alumni Award. I've always admired her. I was in graduate school when Jane was the dean. I'm a double alum at UCSF. I feel so proud to be part of the School of Nursing. I was one of the last in one of the last baccalaureate classes in 1978, and then graduate school 1992. I worked my whole career at UCSF Health, so I'm totally a UC baby. And after I finished my retirement, which was almost about 11 years ago, I decided that UCSF to me means you can stay forever. So I never left. I was on a couple of boards. I was on the Nursing Alumni Board, also served as president there. I also was on the All Alumni Board, AUCSF as well. And I currently sit on the Retirees Board, the UCSF Retirees Board. I also volunteer a lot at UCSF. I take a therapy dog around to visit patients, which is wonderful. I knit caps for babies and adults. And I serve at the food pantry as well and visit patients. So I'm really grateful for my whole career at UCSF Health and my education at the UCSF School of Nursing. So I will always be around, and hopefully I'll see you sometime. Thank you.
Good afternoon. It's a pleasure to be here. And I want to thank everyone who's won, and so well deserved, all of you. It's just wonderful. And I am presenting the Helen Martin Award for Precepting. Before I do want to thank the School of Nursing folks who have planned this event: Kisa Chadiha, Rachel White, Mary Lou Perea, and the lead, Tony Burrell. You've just done a great job. Thanks for putting all this together. My late wife, Helen Marie Martin, was a smart, beautiful, fun, kind, generous, and deeply loving person. Helen was a family nurse practitioner and particularly enjoyed working with underserved populations. Her medical and academic career was notable. Her work with underserved populations included clinics ranging from the Rape Treatment Center at San Francisco General Hospital to community clinics to the pediatric nurse managed clinic in the Mission District, where she was the manager, sponsored by UCSF School of Nursing. I decided to establish this award in Helen's honor and memory because Helen felt passionately about mentoring and teaching nursing trainees. Throughout her career, she worked with trainees. And when she managed Valencia Health Services for over 10 years, she made it a priority to ensure that the clinic offered the best training available for the students. The favorite part of her job was precepting, and this award is a wonderful legacy in her honor and memory. And I'm now going to read Carolyn Devaney's nomination remarks. Carolyn couldn't be here, but for the winner. And here are Carolyn's remarks. As an NP student, I have been amazed by the generosity of my preceptors, but among them, I cannot speak highly enough about time spent with Anna Kuo. As an NP working with older adults in the Tenderloin, Anna practices at the top of her scope and demonstrates fierce advocacy and care for her patients. For many of these patients and their caretakers, she is an extension of family. Anna's practice is the kind of primary care I had imagined in my decision to become an NP, but was no longer sure existed prior to my rotation. Having the opportunity to work alongside Anna helped me find my own capacity and continues to motivate my learning. Congratulations, Anna.
Thank you. Sorry, my video isn't working because I guess I have security settings on here that I can't figure out. So I apologize. But I want to thank UCSF School of Nursing for this opportunity. I'm really grateful and surprised. I really enjoy precepting and learned a lot from my students. I'd like to show them also non-traditional ways of practicing primary care in a low resource setting. But I want to also acknowledge all the patients. Without the patients, there's no learning. So thanks so much.
Hi, everyone. Good afternoon, and congrats to all of our awardees. I'm Angel Kuo, clinical professor and one of the vice chairs in the Department of Family Healthcare Nursing. It is my absolute honor to present to you the Preceptor of the Month awardees this year. This award was created in 2021 by faculty to recognize our exceptional preceptors, in addition to the yearly Helen Martin Award for Precepting. Our clinical training programs could not exist without the contributions and dedications of our amazing clinical preceptors. They are vital partners in our educational programs and serve as our students' mentors even long after the students graduate. In fact, many of them are our past grads who are giving back to our community and the profession. Our preceptors have volunteered countless hours each quarter above and beyond their usual clinical load, where they adopted learner-centered communication and teaching strategies to shape our learners into independent critical thinkers and guiding them to become competent new APRNs. Special thanks goes to our Preceptor Portal Committee and Pamela Dudzik for supporting this work as we rotate through a specialty each month to formally acknowledge and recognize different preceptors across different roles and settings. Please join us in celebrating our Preceptors of the Month awardees from May of 2023 to April of this year. Veronica Fuada, Claire Parker, Elizabeth Cole-Glazer, Diana Kobayashi, Marilyn Budzinski, Nicole Sada, Jennifer Serafin, Ijeoma Okonkwo Pope, Grace Moore Lee, Andrea McDade, Kara Ramos, and Nicole Tilton. You will see more quotes from students for each of them in the upcoming slideshow.
Hi, and good afternoon. My name is Tammy Ryan, and I am the manager in the Office of Clinical Placement. I would like to offer congratulations on behalf of the SON staff to our faculty, preceptors, students, nominees, and award recipients. Today, I want to recognize all of the staff, those who have received awards, those nominated, and those not on the awards list. You are seen and honored for your dedication and the hard work you put in every day. Each staff member has a vital role at UCSF School of Nursing. To all student advisors, our specialists, our business, our policy, and program analysts, to the project managers, those working in facilities, those working in research, our coordinators, our administrative assistants, and executive assistants, to the dean, the assistant dean of the Office of Student Affairs, and the associate dean of Administration and Finance, all of our supervisors and directors. Our work does not go unnoticed and is appreciated. The staff is a part of the foundation and fabric of the SON community. We work collaboratively with faculty and SON leadership to ensure our students are safe, respected, and on a path to success. We are a community. We are a large, diverse family of unique, highly skilled, educated, and motivated individuals who ensure the strategic plan moves forward and the day-to-day operations at UCSF School of Nursing run smoothly. I want to thank the SON staff for showing up and sharing your skills, expertise, and excellence every day with the School of Nursing community. Today, I am shining a spotlight on you. To the SON staff, thank you for all you do. You are appreciated, you are seen, you are heard, and you are honored. And with that, I want to introduce our Administrative Director, Larissa Best, who will present the staff awards. Thank you.
Thank you, Tammy, and good evening, everyone. To conclude our celebration, we would like to honor and recognize this year's staff award. The recipient of these honors include those who have been awarded the Chancellor Award for Exceptional University Service, Staff Achievement Award, and Spot Award. Chancellor Award for Exceptional University Service recognizes individuals for their extraordinary professional commitment and individual contribution to university service. Brandy Wallace-Lagal-Blaine, our academic programs manager in the Social and Behavioral Sciences Department, was honored with the Chancellor Award for her exceptional dedication and contributions to her department, where she went above and beyond in her role. Thank you, Brandy. Achievement Awards recognizes sustained exceptional performance and significant contributions from an employee over an extended period of time. Every year, we receive more nominations than the award we can offer. Achievement Awards are distributed across the entire School of Nursing through a centralized process involving a selection committee comprised of staff, supervisor, and faculty members who represent diverse functional area. All nominations are reviewed by the committee members who then independently vote on the awards. Committee members carefully evaluate an employee's contributions that go above and beyond their job duties, as well as how well the employees embody the UCSF Pride values and aligns with the Chancellor's objectives. Congratulations to the following team members for being selected this year for Achievement Award. Amabet Aklilu, Director of Operations in the Office of Diversity, Inclusion, and Outreach. Amabet received the award for her exceptional leadership in managing Project Belonging, where she demonstrated inclusive and thoughtful leadership. Thank you. Cynthia Mercado Scott, Grants Manager for the School of Nursing. Cynthia received the award for her exceptional leadership in promoting innovation through collaborative partnership and empowering team members through mentorship and accountability. Thank you. Daniel Young, Academic Programs Administrator in the Family Healthcare Nursing Department. Daniel received the award for his exceptional commitment to leading the FNP's BSN to DNP and admissions process and for remarkable performance in his role. Thank you. Bertina Lee, Administrative Operations Supervisor for the School of Nursing Departments. Bertina received the award for her exceptional dedication and contributions in managing the completion of Phase 1 of the School of Nursing reallocation to Mission Bay. Thank you. Anita Sitiawan, Clinical Placements Coordinator in the Office of Clinical Placements. Anita earned the award for her outstanding contributions to the office and to the school and her extensive expertise in clinical placements. Thank you. Pamela Dudzik, Academic Programs Administrator in the Community Health Systems Department. Pamela was honored with the award for her exceptional contributions to innovation, partnership, and collaboration, highlighting her dedication to her work, colleagues, and students. Thank you. Maddie Griffith, Project Manager in the Institute for Health and Aging. Maddie earned the award for her exceptional performance as a project manager of a complex interdisciplinary study in Nigeria and Uganda. Thank you. Rachel De Los Reyes, Academic Program Supervisor for the School of Nursing Departments. Rachel was awarded for her outstanding performance as an academic program supervisor, recognizing her dedication to excellence and commitment to cultivating a positive work environment. Thank you. Spot Awards. Spot Awards acknowledge significant employee accomplishment and contributions, focusing on a specific project or task completed within a relatively short period of time. A Spot Award lets an employee know that someone has noticed their noteworthy contributions. Spot Awards are administered locally by individual department across the school utilizing UCSF-wide guidelines. This year, we are pleased to have a commendable collection of 18 staff members that have received the Spot Award. Congratulations to the following team members for being selected this year for their Spot Awards. Momo Asphalt, Analyst to the Chair and Vice Chairs. Judy Alonzo, Project Policy Analyst. Sandra Blanco, Purchasing and Fiscal Assistant. Tony Burrell, Project Policy Analyst. Genesis Garcia Morena, Operations Assistant. Paige Gilbert, Program Manager. Crystal Hunt, Executive Assistant. Michael Jaffe, Facility Specialist. Ladi Kodam Porasani, Midwifery Mentoring Belonging Coordinator. Kristen Kirksey, Project Policy Analyst. Lisa Cloak, Communications and Social Media Specialist. Bertina Lee, Administrative Operations Supervisor. Nicholas Marley, Analyst to the Chair. Nancy Go, Fiscal Assistant. Marilee Suhei Pereira, Administrative Assistant. Catherine Tam, Communications and Marketing Manager. Griselda Thomas, Academic Programs Administrator. Janelle Villan, Project Manager. Jeremy Wong, Academic Programs Administrator. And finally, Michelle Ying, Financial Services Analyst. Thank you.
Ooh, wow. I know we're right at the last few minutes, and I wanted to just say congratulations to everyone. And then, wow, what a group, what an amazing community. And it's a little overwhelming, and it's really fun to celebrate. We should do this more often for our students, our faculty, and our staff. Before we leave, I want to congratulate all the people that put on the ceremony today. Tony Burrell, Kiza Chadia, Cowrie Keller, Lisa Clope, Sujay Perea, Catherine Tam, Peter Weber, Rachel White, and Ben Wallen from our technical support. And congratulations, everybody. And look forward to continuing our work together. Except for the students who are leaving, come back though. Alumni Association. Great. It was great. Thanks. Bye.